Hi there, my name is Lori Chern from RN Collaborate. Today is October 22nd, 2023. The RNC Restorative Health Program is developed to help you understand how to maximize your own unique and optimal level of health. This is the second of a 7-part series on restorative health. It'll focus on debunking myths on nutrition and what nutrition really is. For the last 70 years, we have had media, marketing, and some flawed research influence our knowledge of food. All the content in this presentation is based on evidence and research directly from biochemists, microbiologists, neurobiologists, molecular biologists, and physicians that focus on nutrition. Information is also provided based on my certifications at both Harvard Medical School and Cornell University. There is no media or marketing within this presentation. This is what media and marketing has done to us over the years. The food pyramid came out by our government teaching us to eat 50% carbs in the form of breads and donuts on our plate. Here's just another reminder that we've been eating meat and fat for centuries since primeval times and have evolved into a strong human race until the last 50 years. Since the 1970s, rates of obesity, cardiovascular diseases, and diabetes have risen exponentially. This coincides with media, marketing, and flawed research over the last 50 years. Mark Hyman, a prominent functional medicine physician in the USA, has coined the phrase that food is the most powerful drug on the planet. There are 37 billion, which are 21 zeros, chemical reactions per second in reaction to the food that we eat. There are 3 macronutrients: carbohydrates, proteins, and fats. Factual knowledge on all 3 of these macronutrients will be discussed. Number 1 is protein. Our requirements are more than a gram of protein per kilogram of body weight per day. We obtain protein from animal products, eggs, dairy, legumes, and nuts. Protein does not spike our blood glucose and therefore does not cause an insulin surge, as we learned in episode 1. Protein is satiating, meaning it satisfies hunger and appetite for longer periods of time and decreases cravings. Protein also helps prevent age-related muscle loss, which we call sarcopenia. And animal products are considered complete proteins because they contain the 9 essential amino acids. Protein is also essential to live. We can obtain our protein from both animal products and plant sources. Animal products are considered complete proteins because they contain the 9 essential amino acids. When we eat, for instance, a piece of chicken, we see a piece of chicken. However, after ingesting the food, our body inside reads chemical structure as illustrated here and is programmed to metabolize these for body functions. On the following slides, we'll briefly review the 9 essential amino acids to bring awareness of how important they are for us to function in a healthy manner. Phenylalanine decreases our rate of cognitive decline and depression and decreases pain. It also regulates adrenaline, which is our fight or flight response. We obtain it from lamb, pork, poultry, oysters, and beef. Valine produces energy and decreases fatigue. It also helps regulate our immune response. Valine stimulates muscle growth and repair, and we obtain it from red meats, dairy, fish, oysters, and soy. Threonine metabolizes our fats. It also improves our immune function, and threonine maintains healthy skin, teeth, collagen, elastin, and muscle tissue. We obtain threonine from lamb, beef, pork, oysters, and gelatin. Tryptophan regulates appetite, sleep, mood, and pain. It also makes melatonin, serotonin, and niacin. It also metabolizes our energy. We obtain tryptophan from turkey, red meats, yogurt, dark chocolate, and milk. Methionine breaks down our fat. It also detoxifies the liver from toxic substances such as lead and mercury. And decreased levels of methionine are associated with osteoarthritis and difficulty healing. We obtain methionine from oysters, tuna, salmon, shrimp, beef, and lamb. Leucine regulates our blood sugar levels. It's essential for metabolism and energy production. Leucine also stimulates muscle growth and tissue regeneration. We obtain it from oysters, cheese, beef, lamb, and poultry. Isoleucine is required for hemoglobin production Hemoglobin is our oxygen-carrying component of our red blood cells. It regulates our blood sugar, and leucine is also needed for energy production and metabolism. We obtain it from beef, tuna, cod, oysters, and haddock. Lysine aids in hormone, enzyme, and antibody production. It facilitates calcium, iron, and zinc absorption. Lysine is required for collagen and elastin production, and it decreases our cortisol levels. We obtain lysine from red meat, oysters, lima beans, and avocados. Histidine is critical for maintaining the myelin sheath, which is a protective barrier that surrounds nerve cells. It also aids in digestive processes and is required for blood cell production. Histidine also helps regulate our sleep-wake cycle. We obtain histidine from haricot beans, oysters, eggs, beef, and poultry. The second macronutrient is fats. They're essential for making our hormones and keeping our hormones balanced. Fat does not make us fat, nor does it increase our blood glucose, and therefore does not induce an insulin surge, as we learned in episode 1. Fat provides a clean fuel for brain and muscles. It's satiating, meaning it curbs our hunger and our cravings, and it facilitates protein absorption. Fat is obtained from animal products, dairy, olives, nuts, seeds, avocado, and coconut, and fat is essential to live. Fats are divided into either saturated fats or unsaturated fats. Saturated fats are mainly found in animal products and coconut oil. They're solid at room temperature. They're not the villain we once thought they were, and several research studies actually indicate that saturated fat does not raise the risk of cardiovascular diseases. This is evidence right out of Harvard Medical School and referenced at the end of this presentation. Unsaturated fats are found in plants such as olive, avocado, nuts, and seeds, and also fish oil. They're liquid at room temperature, and they improve our blood cholesterol levels and decrease inflammation. They're also the healthiest type of fat. The third macronutrient are carbohydrates. They include unprocessed whole grains, fruits, vegetables, beans, lentils, and refined carbs such as pastas and breads. They increase our blood sugar and therefore cause an insulin surge. Each type of carbohydrate stimulates a different blood sugar reaction. For example, apple versus grapes versus white bread versus pasta will all elicit a different blood glucose response. Fruits and vegetables are important sources of vitamins, minerals, fiber, and phytonutrients. There are 13 essential vitamins. We'll learn how important these are. Again, we see the food that we eat, but our bodies see the chemical structure and use the structure to perform other functions in our bodies. Vitamin A is essential for eye health. It also improves immunity. It's also required for reproductive health, growth, and development. We obtain vitamin A from beef liver, fish, oils, milk, eggs, and yellow, orange, and red fruits and vegetables. Vitamin C is required to form blood vessels, cartilage, muscles, and collagen. It's also an antioxidant and improves our immunity. We obtain vitamin C from citrus fruits, tomatoes, strawberries, cruciferous vegetables. Vitamin D inhibits cancer growth. It also reduces inflammation, including in our blood vessels, and improves cardiovascular health. Vitamin D also supports healthy moods and supports calcium absorption and improves our metabolic health. We obtain vitamin D from 15 minutes of unfiltered sun. Vitamin E decreases our risk of cancer. It's essential for brain health, which improves cognitive and thinking function and decreases our risk of neurodegenerative disease such as dementia and Parkinson's. Vitamin E also helps prevent clots from forming in our coronary arteries. We obtain vitamin E from almonds, pumpkin seeds, sunflower seeds, and peanut butter, avocado, and asparagus. Vitamin K facilitates proper absorption of calcium into our bones rather than calcium deposits in our blood vessels. Therefore, vitamin K is an excellent addition to help with osteoporosis and osteopenia. Vitamin K also helps with blood clotting. We obtain it from spinach, kale, Swiss chard, and fermented foods. Vitamin B1, also known as thiamine, is essential for several basic cell functions and for the breakdown of nutrients for energy. Levels in our body are decreased with alcohol abuse or medications like diuretics. B1 deficiency is associated with confusion, memory loss, muscle weakness, peripheral neuropathy, and poor immunity. We obtain B1 from pork, fish, beans, lentils, peas, and sunflower seeds. Vitamin B2, also known as riboflavin, is required for energy production and cell growth. It facilitates the breakdown of fats, steroids, and medications. B2 also reduces oxidative stress and inflammation of our nerves, both that contribute to migraines. Deficiency of B2 is associated with cracked lips, sore throat, hair loss, skin rash, and itchy red eyes. We obtain B2 from beef, pork, beef liver, chicken breasts, salmon, and eggs. Vitamin B3 is also known as niacin. It has over 400 functions in our body. It protects us from cognitive decline and Alzheimer's disease. It also helps convert nutrients into energy. It also creates and repairs DNA. Deficiency of B3 is associated with depression, headaches, fatigue, and memory loss. We obtain niacin from red meat, poultry, fish, brown rice, and nuts. Vitamin B5 is pantothenic acid. It also breaks down fatty acids, and it's currently being studied for a potential role to reduce cholesterol levels by breaking down and clearing the fat from our blood. Deficiency of B5 is associated with fatigue, headache, irritability, disturbed sleep, nausea, and muscle cramps. We obtain B5 from beef, chicken, organ meats, mushrooms, and avocado. Vitamin B6 is also known as pyridoxal 5-phosphate. It's involved in more than 100 processes in our body. It supports our immune function and our brain health. It's safe and effective first-line treatment for pregnancy-related nausea. Deficiency of B6 is associated with depression, compromised immunity, and skin conditions. We obtain B6 from beef liver, tuna, salmon, chicken, and poultry, chickpeas. Vitamin B7 is also known as biotin. It facilitates the breakdown of fats, carbs, and proteins in food for functional capacity in our body. Deficiency of biotin is associated with thinning hair, scaly skin rashes around the eyes, nose, and mouth, and brittle nails. Biotin alcohol actually blocks the absorption of B7, and we obtain it from beef liver, salmon, pork, eggs, and avocado. Vitamin B9, also known as folate or folic acid, is essential for red blood cell production. It helps in the formation of DNA and RNA, and its critical functions are during rapid growth, which include pregnancy and fetal development. B9 should be supplemented with alcohol abuse, with pregnancy, digestive disorders that cause malabsorption of nutrients such as Crohn's. Deficiency of folate is associated with megaloblastic anemia, weakness, fatigue, irregular heartbeat, shortness of breath, difficulty concentrating, hair loss, pale skin, mouth sores, and increased MCVs on our lab values. We obtain folic acid from dark green leafy vegetables, beans, peanuts, sunflower seeds, liver, and eggs. Vitamin B12 is also known as cyanocobalamin. It's essential for brain and nerve cell function and development. Deficiency of B12 is more frequent in people that are vegetarians or vegans, people who are pregnant or have pernicious anemia, the use of antacids, and have intestinal disorders. Deficiency of B12 is associated with fatigue, weakness, nerve damage with numbness, tingling in the hands and feet. We obtain B12 from all meat sources. There are 6 essential electrolytes. Calcium is the most commonly associated with healthy bones and teeth. Important for blood clotting, muscle contraction, regulating normal heart rhythms, and nerve function. Deficiency of calcium is associated with muscle cramps, weakness, numbness, tingling in their fingers, abnormal heart rate, and poor appetite. We obtain calcium from dairy, canned sardines, salmon with bones, almonds, and leafy greens. Phosphorus regulates normal function of our nerves and muscles. It also keeps our blood pH in normal range. High phosphorus in colas, salad dressings, fast foods, and deli meats are associated with poor bone health. We obtain phosphorus from dairy, red meat, poultry, seafood, legumes, and nuts. Potassium carries a small electrical charge that activates several cell and nerve functions. It also helps maintain normal levels of fluid inside our cells. People taking diuretic medications such as Lasix are at high risk for potassium deficiency. Deficiency of potassium is associated with severe nausea and vomiting, fatigue, muscle cramps, weakness, and constipation. We obtain potassium from dried apricots, raisins, beans, lentils, and potatoes. Sodium conducts nerve impulses and muscle contractions. It works in conjunction with potassium. Sodium isn't generally a nutrient that we need to look for, it finds us. The more salt we eat, the more calcium our body loses, which increases our risk for osteoporosis and stomach cancer. We need only about 500 milligrams of sodium a day. Magnesium performs over 400 functions in our body. It regulates our blood sugar. It's associated with bone density, healthy teeth, nerve health, and muscle relaxation. It also helps maintain a regular heart rhythm. Deficiency in magnesium is associated with tension headaches, insomnia, ADD and ADHD, muscle cramps, spasms, and twitches. We obtain magnesium from legumes, dark leafy vegetables, pumpkin seeds, peanut butter, and black beans. Chloride helps regulate the amount of fluid, gases, and nutrients going in and out of our cells. It also stimulates stomach acid that we require for digestion. We obtain chloride from table salt, seaweed, shrimp, and processed food. We have 8 essential minerals. Iron is a major component of hemoglobin, which is a protein in red blood cells that carries our oxygen. Children, women who are menstruating or pregnant, or who use antacids or lacking dietary iron are at risk of iron deficiency. Deficiency of iron is associated with fatigue, weakness, lightheadedness, sensitivity to cold, rapid heartbeat, pale skin, hair loss, and brittle nails. We obtain iron from organ meats, canned sardines, beef, poultry, and canned light tuna. Zinc is required for sensory taste and smell. It builds proteins and heals damaged tissue. Vegetarians, people who are using antacids, are both at risk of zinc deficiency. It is difficult to obtain enough zinc from plant sources, and antacids block absorption of zinc. Symptoms of deficiency include loss of taste and smell, poor appetite, depressed mood, decreased immunity, and delayed wound healing. We obtain zinc from meats, poultry, seafood, pork, and legumes. Copper breaks down and absorbs iron. It builds red blood cells, collagen, and connective tissue. Deficiency of copper is associated with high doses of zinc, malabsorption diseases such as Crohn's, anemia, high cholesterol, osteoporosis, and increased infections. We obtain copper from beef liver, crab, salmon, dark chocolate, and cashews. Manganese breaks down carbs, fats, and proteins for nutrient absorption in our body. Manganese is also essential for immunity, reproductive health, building bones, and tissue repair. It's obtained from shellfish, mussels, oysters, clams, and hazelnuts. Molybdenum breaks down alcohol, drugs, and toxins. It also breaks down purines, which contribute to gout, and sulfites, which are a preservative. We obtain molybdenum from beef liver, black-eyed peas, lima beans, peanuts, and plain yogurt. Selenium is required for DNA production, immune health, and reproductive health. It assists in breaking down peroxides, which damage our DNA and other tissues. Selenium also works well with iodine for a healthy thyroid, and we obtain it from Brazil nuts, finfish, shellfish, beef, turkey, and chicken. Chromium enhances the action of insulin. It also breaks down and absorbs carbs, proteins, and fats. We obtain chromium from broccoli, apples, beef, poultry, and egg yolks. Iodine is needed to make thyroid hormones to regulate our normal metabolism. Deficiency of iodine is associated with disrupted growth and development, low IQ in children, cognitive impairments, and inadequate thyroid hormone production, fatigue, weakness, and sensitivity to cold. We obtain iodine from cod, canned tuna, oysters, shrimp, and table salt fortified with iodine. Hippocrates said in 400 BC, let food be thy medicine and medicine be thy food. We've been living like this for 2,000 years until we started changing things for the worse in 1980. And just a funny post. So after learning all this, what do we need to eat? Number one, prioritize our protein. Consume at least 1 gram per kg of body weight and get at least 30 grams of protein with your first meal. And this is important because it stimulates your muscle production for a day. Number two, do not fear fat. Fat does not make us fat, nor does it raise our blood sugar levels, and it does not encourage our insulin to surge. Try to get a good daily dosing of unsaturated fats, which include fish fat, avocado, and olive oil. Number three, control our carbs. We can still eat pasta and rice, but just try minimize these portions while prioritizing the protein on your plate. Ensure lots of vegetables and whole fruits to obtain essential 30 grams of fiber and a variety of phytonutrients. And number four, just limit the amount of ultra-processed foods that have infiltrated into our lives. They're filled with chemicals such as high fructose corn syrup and hydrogenized oils that our bodies just don't recognize and don't know how to metabolize. Just follow a 30-30-30 rule. Protein, eat a minimum of 30 grams at your first meal. Keep your sugar at less than 30 grams per day and keep your fiber at more than 30 grams a day. We as humans are not smarter than nature, and we will never be. We have survived and evolved since 190,000 BCE, eating the food in nature as noted in this presentation. Since the 1950s, marketing, media, and flawed research has guided us through with ill effects. We have become fat and sick. Technological advances has kept us alive and have increased our lifespan, but not necessarily our health span. The end, and thank you for watching.